guys, welcome back to my channel. My name is Monique Macrin. If you're new here, karibu sana, and if you've been here before, I appreciate you and thank you so much for your continued support. So today we are going to be talking about urinary tract infection, known as UTI. So UTI is one of the most common infection among people, ladies who are sexually active, and it's not limited to them. Even small girls do get UTIs. But today I'm going to talk about UTIs specifically in pregnancy. So how are you able to prevent the frequency of you getting infected with a UTI? The reason you should be concerned when you have a UTI, number one, is that infection, if left untreated for a long period of time, goes up to your kidneys, giving you a more serious infection. Okay, number two, it could trigger a miscarriage. Okay, number three, it is not comfortable. Number four, you could get into sepsis. The infection could become too much for your body to handle. And lastly, why would you have an infection that you do not treat anyway? Okay, so yeah, but before we go to treating, it's always good to know how can I be able to prevent a UTI. We are going to start. Okay, so the first thing, you have to make sure that your hygiene is, and especially during pregnancy, because remember, when you're pregnant, your immunity goes down. Yeah, so that is why most pregnant women usually have UTIs. Let me tell you, in my first pregnancy, I used to every day nakunywa tu amoxil, azithromycin, CG, Flagyl. It was too much, and I didn't know some of the things that I know now. With this current pregnancy, by the way, I've only gotten UTI once, which was very mild, and I just had to drink water and it was gone. Like, I've never had to deal with a UTI before. So I'm very sure that these tips that I'm going to tell you have worked for me and can also work for you. Okay, so number one, make sure that you are hydrated. Keep hydrating. Keep hydrated. Hydration is very important. Number two, when you're going to the toilet, observe hygiene. Yeah, so make sure that you wash your hands. Remember, those are the hands that are going to touch the tissue that will wipe your girl area. Yeah, so you don't want to have, and then I'm imagining you've been busy during the day, you've touched surfaces so your hands have germs, your hands are contaminated. So if you go and take your tissue, then wipe yourself, you're going to leave bacteria in there, increasing your chances of getting a UTI. That is why you have to wash your hands before you go to the toilet. Number two, flush that toilet first. If it is a public toilet, actually even at home, I just make it a habit. You flush the toilet first. You don't know who was there, and you don't know if they actually flushed. Yeah, so flush your toilet. Then if maybe you're going for a long haul, sanitize the area that you're going to sit on. Yeah, after sanitizing the area that you're going to sit on, then you sit, do your business, and then wipe yourself from front to back. I think everyone knows that by now. If you're watching this video, I'm thinking you're like about 10 years of age, so you know that, ladies, you have to wipe yourself from front to back. Yes, so that is proper hygiene for when you're going to the washroom. Then after you move from the washroom, of course, you have to wash your hands again. The second, now if you have long nails, I make it a habit. When my nails are long, you also have to have a brush for your nails. So now and then you make sure that you're brushing the insides of your nails, because you can imagine they have a lot of germs in there, but these ones are short. Another way that you can be able to prevent UTI is when you go for a long call, make sure that as much as you're wiping yourself with a tissue, also have a wet wipe with you, and a wet wipe that is not scented. The reason you need a wet wipe is because a tissue might not always be able to get rid of the fecal matter. So, but when you have a wet wipe with you, after using the tissue, now you use the wet wipe, it has water, so it's going to clean everything. Now, it's important because most of the time, the UTI that you get is usually from the bacteria from your colon and all. So usually those bacteria find a way of going to the vaginal region, and because our urethra is short, that is why we get a lot of UTIs. Now, the reason I'm insisting on making sure that you use that Kawet wipe is because if you're pregnant, I'm assuming you have a sexual partner, yeah? So if that time comes, you reduce the likelihood of him transferring the bacteria from the anal region to your reproductive system. Okay? Yes. Does that make sense? I hope it does. But please make sure that the wet wipe that you're using is not scented. Scented wet wipes are going to tamper with your pH, increasing your chances of getting the UTI again. Another way of preventing UTI is when you and your person are, you want to get intimate, ensure that his hands are clean, because imagine you've observed your hygiene, you've washed your hands, you're taking care of the toilet seat, and then your person comes with his dirty hands from wherever and starts touching you. You've done zero work. So yes, observe your hygiene, and also make sure your person washes their hands before they can join the table. Okay? You can also prevent UTI by making sure that you pee. You go for a short call at least 30 minutes after sexual intercourse. Actually, it is advised to go for a short call before and after. But honestly, when you look at the flow of events, it's unlikely that you'll go before a short call, but before intercourse. But after intercourse, make sure that before 30 minutes elapse, you go for a short call. The reason we say that is because, number one, we say that your urethra is very short, yeah? So the distance that these bacteria move from the point of entry to the bladder, that distance is very short. Now, after, let's say during intercourse, probably either your man touched you with dirty hands, or for some reason there was movement of bacteria from the anal region to your reproductive region. So in that case, when you urinate, this urine is going to wash off all the bacteria that had been introduced to your urinary system. By the way, it's not the reproductive system. UTI iko kwa urinary tract, yeah. So when you go for a short call, the urine is going to wash away the bacteria that had been introduced. And also the urine is not the optimum medium for the bacteria to multiply, so it makes it an excellent washer of bacteria. Yes. Okay, so another way of preventing UTI is making sure that you maintain the flora of your that area. Okay, so usually we have bacteria and fungi in the vagina. Okay, so if by any chance there's an overgrowth, okay, if by any chance you kill all the yeast in the vagina, then that means the bacteria is going to overgrow, and that leads to a UTI infection. So you always have to make sure that you maintain the natural environment of your vagina to ensure that you minimize your chances of causing an imbalance between the bacteria and the yeast that is naturally found there. And by that, when I'm talking about bacteria, don't look at it like, oh God, this is a bacteria. No, we actually have the good bacteria. So that bacteria and the yeast is supposed to stay in there, but in a balanced way. So things that can interfere with that is maybe increase of pH, which can happen when you use a lot of feminine wash. Honestly, make sure that whatever you're using to wash yourself is not scented, is not strong, and you're not supposed to wash the insides. You're not even supposed to go inside your vulva. No, you just wash the exteriors all the way to the anal region. You can use mild soap and water, but the inside, just leave it like that. That organ is self-cleansing. So you find a lot of people going to and buying these commercial fem washes, and that could be the cause of the reason why, that could be the reason why you have to keep on treating recurrent infections. I know at some point you can find your gynecologist recommending a particular fem wash, and in that case I believe he or she has reasons why she has prescribed that, and most of the times it's usually a brand that is trusted and for a given period of time, yeah. So unless it is a prescription, please stay away from feminine washes. Stay away from douching. We usually say do not wash the inside of the vulva. That is going to take care of itself. You just wash the exterior. Another reason, there are those people who usually spray themselves on the inner sides of the thighs. Yes. You find people, mtu amechukua perfume, you spray yourself and then you spray the insides of your thighs. Honestly, guys, that is interfering with the pH of your region. When you're washing your panties, try to wash them in soap that is also not scented. Hang them outside because the sun usually helps in drying. And so when you're washing your panties, do not use the fabric softeners, do not use scented soap and then hang them outside. By doing that, at least you know for sure you are not causing an imbalance of your natural environment. Another way of preventing a UTI is making sure that you do not retain urine in your bladder for too long. If you feel the urge to go to the toilet, please go to the toilet. I know sometimes you usually think that if you the ability to hold pee is like an exercise bladder muscles, but honestly no. If you need any exercise for that region, do Kegel exercises. But holding urine inside there for too long, and no, you're increasing chances of those bacteria incubating in there. So when you feel the need to go to the toilet, go to the toilet. Observe hygiene. Ensure that you do not interfere with the natural environment of your vagina. Ensure that you encourage your partner to also observe hygiene, so that during intimacy you don't put yourself at risk. And in any case, when you pee 30 minutes after intercourse, you actually minimize the chances of the infection, the bacteria going up. I feel like I have covered almost everything, and if I haven't, please feel free to add in the comment section. Now, before I finish this video, it is important to know that in case you actually get a bacterial infection, you're going to be treated using antibiotics. Now, most of the times when you use antibiotics to treat this infection, they might kill even the good bacteria. If this happens, then that means you are likely to get a yeast infection. And in the next video, I will explain to you how you can prevent yeast infection, and in the event that you have to take the antibiotics, how you can protect yourself from getting yeast infection as a result of treating a UTI infection. So now, guys, let's carry our belly comfortably. Let's prevent those infections. I mean, you're going through a lot. The last thing you need is to be taking antibiotics, by the way. I enjoyed making this video, and this also applies to even someone who's not pregnant. These UTIs are very common. If you like this kind of a video, please let us engage on the comment section, and share this video with your sisters, with your mothers, your booms, your babes. Until next time.